Imagine this for a second. You're sitting at home, maybe scrolling on your phone, maybe feeling that familiar pressure in your head, your chest a little tight, your body just not fully relaxed. You check your blood pressure, and the numbers are higher than they should be. Now, what if I told you that one of Japan's oldest practicing doctors says you can calm your nervous system and support healthier blood pressure in just a few minutes, without pills, without equipment, just by learning how to breathe the right way? That might sound too simple to be true, but stay with me, because by the end of this video you'll know 3 powerful breathing techniques that this legendary Japanese doctor has taught for decades. Techniques designed to relax your body, quiet your mind, and help your blood pressure come down naturally and safely. And the best part is, you can start practicing them today, right where you are. When we talk about lowering blood pressure naturally, one of the most overlooked truths is that the breath is not just air moving in and out of the lungs, it is a direct control switch for the nervous system. Most people don't realize that the way they breathe every day is constantly sending signals to the brain about whether the body is safe or under threat. Shallow, fast breathing tells the body to stay alert, tense, and ready to react, and when the body stays in that mode for hours or years, blood pressure often stays high. Japan's oldest doctor explains that breathing is the fastest way to communicate with the nervous system because it works instantly, without waiting for digestion, medication, or external changes. The moment you slow your breath, your body begins to listen and respond. This is why breathing is such a powerful natural tool, especially for people who feel stressed, overwhelmed, or constantly tense without realizing it. When breathing becomes calm and controlled, the nervous system shifts away from fight or flight and moves into a rest and recovery state. This shift tells the heart it doesn't need to pump as hard, and it tells the blood vessels they can soften and widen instead of staying tight and restricted. Over time, this relaxed internal environment supports healthier blood pressure levels without forcing the body to do anything unnatural. The doctor often says that the body already knows how to heal and balance itself, but it needs the right conditions, and proper breathing creates those conditions. Instead of pushing the body harder, breathing works by allowing the body to let go. Another important idea is that breathing brings awareness back into the body. Many people with high blood pressure live mostly in their heads, worrying about the future, replaying the past, or reacting to stress nonstop. Conscious breathing gently pulls attention back into the present moment. This mental shift alone can reduce emotional tension, which is a major hidden factor behind high blood pressure. When the mind calms down, the body follows naturally. This is not magic or belief. It is how the nervous system is designed to work. The beauty of breathing as a health tool is that it is always available. You don't need equipment, money, or perfect conditions. You can practice it while sitting, standing, or lying down. You can use it during stress, before sleep, or when you wake up. Each calm breath is like pressing a reset button for the body. Over time, these small resets add up, helping the nervous system learn a new default state that is calmer and more balanced. Japan's oldest doctor emphasizes that breathing is not about effort or force. It is about cooperation with the body. When breathing becomes gentle and mindful, it stops being just a physical action and becomes a form of communication. You are telling your heart, your blood vessels, and your nervous system that it is safe to relax, safe to slow down, safe to restore balance. And when the body receives that message again and again, it begins to respond in a way that supports lower blood pressure and long-term health without resistance. One of the fastest ways to influence blood pressure is by changing the way you breathe out, and this is something Japan's oldest doctor emphasizes again and again because it works so quickly and naturally. Most people focus on how deeply they inhale, but the real power lies in the exhale. When the exhale is short and rushed, the body stays in a state of alertness. When the exhale becomes slow, smooth, and slightly longer than the inhale, the nervous system immediately begins to relax. This simple shift sends a clear signal to the brain that there is no danger, no urgency. and no need to stay tense, and that message travels instantly to the heart and blood vessels. A slow exhale activates the parasympathetic nervous system, which is responsible for rest, digestion, and recovery. This system works like a natural brake for the heart. As it turns on, the heart rate gently slows down, and the pressure inside the blood vessels begins to decrease. This is why many people feel calmer within seconds of extending their exhale. It is not imagination, it is a biological response built into the body. The doctor often explains that when stress rises suddenly, blood pressure rises because the body thinks it needs to prepare for action. By slowing the exhale, you interrupt that stress response and guide the body back toward balance. Another important aspect of a slow exhale is muscle release. Tension in the shoulders, neck, jaw, and chest often goes unnoticed, yet it contributes to internal pressure. A long, relaxed exhale naturally encourages these muscles to soften. As the muscles release, the blood vessels are no longer compressed by surrounding tension, allowing blood to flow more freely. This physical relaxation supports emotional calm as well, creating a feedback loop that continues to reduce stress and pressure. The doctor also teaches that the exhale should never be forced. Forcing the breath creates strain, which can trigger the opposite response. Instead, the exhale should feel like a gentle letting go, as if you are releasing a sigh of relief. This softness is what makes the technique safe and effective for people of all ages. Even a few slow exhales can make a noticeable difference during moments of anxiety, frustration, or physical discomfort. Over time, practicing longer exhales trains the body to breathe more efficiently throughout the day. The nervous system learns that it does not need to stay on high alert, and this new pattern becomes more automatic. Instead of reacting instantly to stress, the body pauses, breathes, and settles. This is especially helpful for people whose blood pressure rises easily due to emotional triggers or mental overload. Japan's oldest doctor believes that this breathing technique is powerful because it works with the body rather than against it. You are not trying to control blood pressure directly, you are creating the conditions where pressure naturally decreases. With each slow exhale, you are reminding the body that it can relax, that it can trust the moment, that it does not need to rush or resist. And when that message is repeated gently and consistently, the body responds by lowering internal tension and supporting healthier blood pressure in a calm and natural way. Belly breathing is one of the most important habits Japan's oldest doctor teaches because it changes the way the body handles stress at its foundation. Most adults breathe high in the chest without realizing it, especially when they are busy, anxious, or focused on screens for long periods of time. Chest breathing keeps the body in a mild state of tension, even when there is no real threat. Belly breathing, on the other hand, tells the nervous system that it is safe to relax. When the breath moves deep into the abdomen, the diaphragm works properly, oxygen exchange improves, and the body naturally shifts into a calmer, more balanced state. When you breathe into the belly, the abdomen gently expands on the inhale and softly falls on the exhale, while the chest remains mostly still. This movement massages the internal organs, improves circulation, and supports better digestion, all of which are connected to overall cardiovascular health. The doctor explains that the body is designed to breathe this way, and when we return to it, many systems begin to function more efficiently without extra effort. Blood vessels are less tense, the heart does not have to work as hard, and the baseline level of stress in the body starts to drop. One of the most powerful effects of belly breathing is that it retrains the nervous system over time. At first, you may need to think about breathing this way, but with regular practice it becomes automatic. This means that even during stressful situations, your body is less likely to overreact. Instead of shallow, rapid breathing that pushes blood pressure up, the body maintains a slower, deeper rhythm that supports stability. This long-term shift is what makes belly breathing so valuable for people dealing with consistently high blood pressure. Another benefit is emotional grounding. Belly breathing brings attention downward into the body, away from racing thoughts and constant mental stimulation. Many people with high blood pressure carry unprocessed stress, worry, or emotional tension. By breathing into the abdomen, you create a sense of steadiness and presence. This emotional calm directly affects the heart and blood vessels because the mind and body are deeply connected. When emotional stress decreases, physical pressure often decreases as well. The doctor often recommends practicing belly breathing at specific moments in the day, such as after waking up, before meals, or before sleep. These moments help anchor the nervous system in a calm state and prevent stress from accumulating. Even a few minutes of conscious belly breathing can reset the body and prevent tension from building up unnoticed. Over weeks and months, these small daily practices add up, creating a more relaxed internal environment that supports healthier blood pressure naturally. Belly breathing is not about forcing the breath deeper or trying to control the body. It is about allowing the breath to move the way it was always meant to. When the body feels this gentle, rhythmic movement again and again, it learns that it does not need to stay tense or guarded. This sense of safety is what allows the heart to slow down, the blood vessels to soften, and the entire system to function with less strain, supporting long-term balance and well-being through something as simple and natural as the breath. Rhythmic breathing plays a powerful role in calming high blood pressure because the heart responds deeply to patterns and consistency. Japan's oldest doctor often explains that the heart and breath are meant to move together in harmony, not in chaos. When breathing is irregular, rushed, or unpredictable, the heart mirrors that instability by working harder and faster than necessary. Rhythmic breathing gently restores order to this system by giving the body a steady, reassuring pattern to follow. As the breath settles into a smooth rhythm, the heart begins to synchronize with it, creating a sense of internal balance that directly supports healthier blood pressure. One of the key benefits of rhythmic breathing is its effect on heart rate variability, which is the natural variation in time between heartbeats. Higher heart rate variability is associated with better cardiovascular health and a more resilient nervous system. When you breathe in a slow, consistent pattern, the nervous system becomes more adaptable rather than reactive. This adaptability allows the body to respond to stress without becoming overwhelmed. Over time, this leads to a more stable internal environment where blood pressure is less likely to spike in response to emotional or physical triggers. Rhythmic breathing also has a calming effect on the mind, which is crucial because mental stress is a major contributor to high blood pressure. When the breath follows a gentle count, the mind naturally focuses on that rhythm instead of jumping from thought to thought. This mental quieting reduces the constant background noise of worry and tension that many people carry throughout the day. As the mind becomes calmer, the signals it sends to the body become calmer as well, allowing the heart and blood vessels to relax. Another important aspect of this technique is the brief, comfortable pause between the inhale and exhale. This pause is not about holding the breath forcefully, but about allowing a moment of stillness. That moment teaches the nervous system that it is safe to slow down and rest. In daily life, many people rush from one moment to the next without pause, and that same urgency shows up in their breathing and heart function. Introducing a gentle pause retrains the body to move at a healthier pace. Japan's oldest doctor emphasizes that rhythmic breathing should feel soothing rather than mechanical. The counts are simply a guide, not a rule. What matters most is the sense of flow, like waves moving in and out without resistance. When breathing feels smooth and natural, the body responds with relaxation instead of tension. This is why people often report feeling centered and grounded after practicing rhythmic breathing, even for a short time. With consistent practice, rhythmic breathing becomes more than an exercise, it becomes a way of being. The body learns to maintain calm patterns even during challenges. Instead of reacting instantly to stress with tightness and elevated pressure, the system responds with steadiness and control. This ongoing harmony between breath, heart, and mind reduces internal strain and supports healthier blood pressure naturally, by allowing the cardiovascular system to function in a state of balance rather than constant alertness. One of the most important lessons Japan's oldest doctor teaches is that healing does not come from force, intensity, or struggle, but from consistency, gentleness, and awareness. Many people approach health with the idea that they must push harder, breathe deeper, or do more to fix their problems. When it comes to breathing and blood pressure, this mindset can actually create more tension. Forced breathing, aggressive techniques, or unrealistic expectations send signals of effort and strain to the nervous system, which can raise stress instead of lowering it. The doctor reminds his patients that the body responds best when it feels supported, not pressured. Gentle breathing allows the nervous system to relax without resistance. When the breath is soft and natural, the body does not feel threatened or controlled. This sense of ease is essential for long-term change because the nervous system learns through repetition, not intensity. A few minutes of calm breathing practiced daily has a far greater effect than long, occasional sessions done with strain. Consistency teaches the body what its new normal should be, and over time, that normal becomes calmer, steadier, and more balanced. Awareness is what turns breathing into a healing practice rather than an automatic habit. When you become aware of your breath, you also become aware of tension in your body and mind. This awareness allows you to release tightness before it builds up and affects your heart and blood vessels. Many people live in a constant state of mild stress without noticing it. Gentle awareness brings that stress into consciousness, where it can be softened rather than ignored. This is why the doctor emphasizes noticing the breath throughout the day, not just during formal practice. Another key idea is patience. Blood pressure does not rise overnight, and it rarely returns to balance overnight either. The doctor encourages people to trust the process rather than chase quick results. When you breathe gently and consistently, you are working with your body's natural rhythms. This approach reduces frustration and anxiety, which are themselves contributors to high blood pressure. By letting go of the need to control outcomes, you create an internal environment where healing can unfold naturally. Consistency also builds confidence. As you notice small changes, such as feeling calmer, sleeping better, or reacting less strongly to stress, you begin to trust your body again. This trust further relaxes the nervous system and reinforces positive patterns. Instead of seeing your body as a problem to be fixed, you start seeing it as an intelligent system that responds to care and attention. Japan's oldest doctor believes that true health comes from harmony, not struggle. Breathing is meant to be a friend, not a challenge. When practiced gently, with awareness and regularity, it becomes a quiet support system that works in the background of your life. Each calm breath reinforces safety, balance, and stability, allowing the heart to function with less effort and the blood vessels to remain relaxed, creating the conditions for healthier blood pressure and long-term well-being through a practice that feels simple, natural, and sustainable